Let's discuss today about the different types of the tummy tuck procedure. The medical terminology for a tummy tuck is called as a lipo-abdominoplasty. One thing you need to remember is that this procedure can be done in men as well as women. In men, a post-massive weight loss or post-bariatric surgery, they also experience a lot of excess sagging skin in the lower abdomen, sometimes in the flanks and the lower back. For them too, we do a lipo-abdominoplasty. In them too, we do a post-massive weight loss, post-bariatric surgery. It could be post-multiple pregnancies, for which they experience the similar problem. Now let me explain to you what are the different types of tummy tuck that we have, and we talk about a mini tummy tuck, a standard tummy tuck, an extended tummy tuck, and a belt lipectomy. So I have here drawn a very simple figure. So when we talk about a mini tummy tuck, as we know, tummy tuck is a removal of excess skin and fat in the lower part of the abdomen, as well as removal of fat with liposuction 360 degrees, which I perform in most of the patients. When we think of a mini tummy tuck is when the person just has a moderate, very minimal amount of skin and fat below the belly button. They do not have too much of excess skin extending towards the corners. So in that situation, we make a very short scar at the lower part of the abdomen, and we remove the little bit of excess skin at that portion. Now when a patient has a lot of excess skin and fat extending to the corners, in that situation we need to make a longer cut, and that is why we make a long incision. Now in case of many women, they have already undergone a C-section. So in a C-section, they already have a present scar. We utilize the same C-section scar, and what we do is extend the cut towards the corners. Now there is no choice but to extend this incision and scar line, because the patient has a lot of skin which is extending up to the sides of the abdomen, including the flanks. So this could be a scar here we call as a standard tummy tuck. Then we talk about an extended tummy tuck, where the skin excess is going towards the sides of the abdomen beyond the waist and the lower flanks. In that case, we have to extend this incision much beyond going to the back. Now in case we do not extend the incision and we try to remove the skin and fat in the lower abdomen and try to cut short the incision, remember, you can develop a little bit of dog ears on the side. So if there is a lot of skin extending to the corners, I prefer to make the incision. We plan the incision and scar within your panty line, so that even if you are wearing a high waist bikini, the scar will be hidden. But if we do not extend the scar behind and try to remove the skin, cut short the incision, then if you can notice, you will tend to have these dog ears on the sides. So that is why we perform an extended tummy tuck. In situation, especially patients post-bariatric surgery have massive weight loss, they also experience sagging skin at the lower back region. So we have to remove the excess skin and fat in the front of the abdomen as well as the back of the abdomen. So when we look at the back of the abdomen, and you have the buttock region, so the scars will come at the back, outline just the upper edge of the buttock region. Yes, you will have a scar at the back, but we make the scar all around and plan it in such a way it will take the contours on the upper side of the buttock. I was asked this question, whether do you get a lift of the hips and the glutes? Yes, especially when we do a belt lipectomy. So we are removing excess skin and fat in the front, and we are also removing excess skin and fat towards the back as well as the side. So when we are removing this part of the skin from the back region, and we are bringing the skin to this particular scar line, glute as well as a lateral hip and upper thigh lift will also be achieved. This is very commonly done in post-bariatric surgery patients and massive weight loss patients. In a standard tummy tuck, we stick to the incision, which is along the C-section line. In case they don't have a C-section, we plan the scar about 8 to 10 centimeters from the pubis, just above the pubic hairline, and we need to extend the scar to the sides in order to remove the excess skin. So it all depends on the individual patient and the amount and the extent of skin that they have. Every lipo-abdominoplasty is a combination of liposuction and skin removal. So the procedure always starts with doing a 360 degrees liposuction. In case a person has a lot of surrounding fat, we do moderate quantities of fat removal and we ask them for a stage 2 liposuction, possibly about 6-8 months later. But our main intention would be always in a tummy tuck to remove excess skin and fat in the front, sides, and we do not hesitate to increase the length of the incision because we want to make sure we do not leave behind the dog ears. Very importantly, there are the midline muscles which are present for the rectus muscles, and these tend to be separated in many of the patients. So the midline muscle repair is important, as well as repositioning of the belly button, the 3 most important components of the tummy tuck. So I hope today you have understood what is a standard tummy tuck, a mini tummy tuck, an extended tummy tuck, and a belt lipectomy.